your Houston chiropractor, Dr. Gregory Johnson, and today we're going to go through a treatment session with Mike, and he has absolutely no pain whatsoever after this will be his third visit. So I want to show you how we treat a patient that's not in any pain, but still how to identify whether they're subluxated or misaligned or not. So let's have you look in the mirror for me first here, Mike. We're going to evaluate your posture. Flex your head forward all the way, backward all the way. Now, as you can tell, he has a pretty good range of motion, but when he went backward, you saw how it kinked right there at the very last. Did that feel like it kinked right there?
Yes, sir.
Yep. And his head is a little forward in his posture, which is a positive SZ translation. His head and neck are translated to the right, which is a negative SX cervical. He's got just a little rotation. You side sleeper, right?
Yes, sir.
Yep. So we can usually tell when somebody's a side sleeper or stomach sleeper because their spine will be rotated that way too, and his is all rotated to the left. And then his pelvis is just a little right of center. You see how this side's closer?
Yes, sir.
And this one there. Very good. Okay, let's lay you down on your back right here. We're going to decompress him. Mike's an athlete, has been all your life, right?
Yes, sir.
All right. Yeah. And what brought you to see us first? Let's, just so that our YouTube visitors will know. Go ahead and just scoot straight up that way. That's all right. There you go. Now scoot back over in the center just a little bit. There you go.
I was having shoulder pain, hip pains.
I don't know if you can hear him. He's having shoulder pain and pain in both of his hips. Which the hips are out here. A lot of people think their hips are back here. That's the sacroiliac joints. These are your hips. He was actually having hip pain, so he described it properly. Alright, yeah. Still, we get the pelvis in tight on both sides so that we lock down the pelvis in a stationary way on the left and right iliac crest. When we're bringing the legs up, that changes the angle of his pelvis, which also relaxes the spinal muscles from his low back all the way up. Need to oil our table down, use a little WD-40. Then I get just a common bath towel, and I get it wet so that I get a better contact and grip. I know a lot of you have asked questions on that, so now you know. Now lift your hand up, there you go, now lay it right on back. And I want you just to keep your teeth together, take a deep breath through your nose. Let it all out. Excellent. Now, we didn't even have to pull him that hard, but I bet you felt that all the way through, didn't you?
Yes, sir.
Yep, good. And again, we always check the reflexes post. He's doing good. And while he's in a relaxed position, I'm going to go ahead and adjust his cervical spine with a Palmer diversified adjustment of his cervical spine. Very good. Now, a lot of you probably see me close my eyes when I adjust sometimes because I get a better feel of the patient's range of motion and their joint integrity. And then I know exactly how hard, let's go this way, to adjust and get them to move in their vertebral motor units maximum range of motion, which is what we're wanting. And you might ask, why is he coming in here if he doesn't have any pain? The reason that he's coming in here to get his spine corrected is because he's a young man who thinks of the future, which is a lot better than a lot of the older men that come in that didn't think of their future when they were young men. When you take care of these problems when you're Mike's age, then you don't grow up to have degenerative disc disease, degenerative spinal disorders, degenerative joint disease, which all those mean osteoarthritis. So you can actually prevent osteoarthritis, disc degeneration, herniated disc, bulged disc, nice and easy, there we go. And I'm going to let your head down just a little bit if you'll scoot up in there for me, Mike, thank you. And we're just doing a nice general mobilization through his thoracic spine. That moved really well. And he had a lot of problems right up here in that upper back with those upper back muscles and traps into his shoulder itself. And then he also had a little incident a few years ago with your AC joint, didn't you?
Yes, sir.
Yep. So we're making sure we're lining up the entire cervical thoracic region, the clavicle, and the shoulder blade itself. Now, as you've noticed, I've got a new terminator. We're going to call this one the Johnsonator. I would just call it Johnson, but you know the implications of that. So, now, you'll find when you're doing this that you'll actually feel the patient's muscles contracting automatically when you're doing this. And you find out where it's sore as well. Okay, excellent. Now that we have stimulated his entire body with deep tissue, myofascial release, you saw how deep that Johnsonator can get. There were some tender spots when I was doing that too, huh, Mike?
Yes, sir.
Yeah. But you can always tell when you're on the patient using that, because they'll give kind of an involuntary little flinch or hypertonicity in those muscles, and then we use a high-speed variable speed vibrator to increase the circulation into the tissues, helps them relax a little bit more, and that way the blood can carry out all the metabolic waste products of just normal everyday cellular metabolism. Besides that, it feels pretty good, huh, Mike?
Yes, sir.
Alright. Yep. Very good. Very good. Okay. Now, we got two other procedures that I'm going to check him on here. Let's see, let's get your way up in there a little bit more. And that is his upper thoracics right here, which he's got just a tad, which means a little bit of misalignment right here. But that wasn't too bad. Okay, let's turn on your back for me again. And now that he's on his back, let me see your arms up over your head like this. Just like doing a leg length check, we're checking his hands and shoulders stretched all the way out. And if you can get that, see that, Renee? His fingers are exactly even, which means he had good balance up in his upper torso and his shoulders. You can put them down there and relax. That's excellent. Now, if you don't mind, Mike, I'm going to have you slide it all the way down on the table until your legs are hanging all the way over. A little bit more maybe, because you're tall. Now lay back for me. Now, I adjust the acromioclavicular joints, put your arms straight out like that, as well as the claviculo-sternal or sternoclavicular joint right here anteriorly. Excellent. And these are the anterior rib cage where they attach to the sternum. And when the mid-thoracic spine is out of place, the ribs that attach to them often become misaligned too. Perfect. Good. Now let me have to go sideways. There you go. Let's turn towards Renee. There's it. There you go. Now, I'm going to check his shoulders, and this one does have some grinding and crepitus in it when we move it. It's not a lot of pain though, is it, Mike?
No, sir.
There we go, and I'm sure you could hear that one all the way over there. That was setting the glenohumeral joint, which is the actual ball and socket of the shoulder joint. Same thing on the left there. Those were excellent. Mike relaxes really good and breathes really good. That helps. Excellent. Good. Mike, you've seen other chiropractors in the past, haven't you?
Yes, sir.
And can you tell our YouTube viewers what you find different about our office from the other chiropractors that you've been to?
Well, after one visit, I really had no pain, which is, I've had pain for years, about 5 or 6 years, shoulder pain, hip pains, but.
Excellent. Yeah, go ahead.
Oh, and I mean, just one visit, it was just totally different. I mean, the second visit, no pain at all, none whatsoever. I think the first visit, maybe one small little pain on my hip, but other than that, no pain.
Do you find though that
This is totally different
it's
too, though.
much more different procedures and
Yeah, everything you've done, I've never had done actually before.
by any other chiropractors? Yeah.
None. Even when I had shoulder pain, they really didn't pop it or.
You adjust your shoulders.
No, none at all.
Yeah. Well, we spend very focused time on our patients, and we dedicate the entire time I spend with the patients on the patient's entire body. And you notice I don't send them off to therapy here, get a hot pack there, electrical muscle stim here. We do everything ourselves. So we're going to bring him over here, and we're going to shoot him with the gun last, which we do with all of our patients to provide what's called neuromuscular re-education. We're going to retrain his cerebellum how to hold him in places. Close your eyes and flex your head forward and backwards again. Now watch his extension. Should be better already. Yes, it is. Better. Now let's pull these up here. We'll flare those there. I'm going to bring your head straight back, and then we're going to translate you to the right just a little bit. And if you'll shift your pelvis straight left, there you go. With that chin up. Perfect. Now we're adjusting his atlas on the x-axis while he's in a mirror image. Okay, you can relax. And let's do that one more time. Flex forward and then backwards. And neutral. Yes, that was easiest of all, wasn't it?
Yes, sir.
Now see how his head's up and back over, his shoulders are squared off. Now three-dimensionally on the y-axis, the x-axis, and the z-axis, this is gravity. Does that feel strong?
Yes, sir.
See, now because his spine is lined up properly in that three-dimensional X, Y, Z axes, the joints of the spine are doing the weight bearing rather than the muscles and the disc. So it takes less energy for his body to function all day long. You can find us at AdvancedHoustonChiropractor.com. This is your Houston chiropractor, Dr. Gregory Johnson, and we'll see you next time.